and the standards and guidelines given for data sharing, not only for Maldives, but for the entire global south and even for the entire world. So that if, like, I'll give a very simple example. You use Google or the Maps software, any platform, and since all of your mobiles are switched on and sharing your data, it is so accurate. But if in the early phases, when you didn't have your lot of mobile connectivity in smart platforms, it was not that accurate. So it's same here. So those are my comments on that.
Padma, those insights were very enlightening. Now, beyond technology, a true healthcare transformation requires the right mindset and the right culture as well. And if we are not actively working on establishing the right culture in our institutions, it might actually be working against us. We are giving or risking the wrong culture to take root. My question is to Tahe. I would like to ask you, what are the key elements necessary to establish a culture of effective communication within healthcare teams? Additionally, could you touch upon the concept of psychological safety in healthcare cultures and how it contributes to patient safety?
Thank you. I think the culture, what you have talked about, in the key element in effective communication is having the psychological safety. That's definite. But when it comes to communication, actually communication is the thing in healthcare. Sitting at Ministry of Health, we have been reviewing complaints after complaints. We have been reviewing cases. And the first thing that pops up as the main gap is communication. Communication in terms of, are we talking all this medical jargon to the patients who have no clue whatsoever what you're talking about? We talk in English. We are talking in English. The Maldivian community, they understand English, but they don't understand medical language. So we need to say that when we talk about communication, are we talking in a language? Are we talking in a dialect? Are we talking in a way that they understand? So it's very, very important for effective communication that when we talk to patients, we talk in a way that they understand. And another thing about communication is it's not one way. It's a two-way communication. It's not the doctor or the nurse who should be speaking more. It should be the patient who's speaking more, because we need to hear their stories. We need to really dive into their concerns, what their complaints are, why did they come here? Because we all know that none of us, I don't think any one of us will have time to go and sit in a hospital for no reason. We would love to go to a park, but then I don't think anyone would want, anyone of us want to go and sit in a hospital. For fun, we don't go there. There's a reason we go there. There's a reason we are there, I would say. We as healthcare workers, we are there because we have patients, we have the caregivers, otherwise we will not be there. So communication is very important, and communication with the patient, communication with the team is again very, very important. We are talking about diagnostic safety today, and we are not talking about a single healthcare professional. We are talking about multiple healthcare professionals. We are talking about multiple departments as well. So again, it's very, very important that we talk as a team, we communicate as a team, and also communicate with the management. Again, it's very important. What are the issues that we have in actually diagnosing the patient? What are the things, what are the concerns that we are not able to address of the patient? The management needs to step in. However, for this communication to happen, it's very easy to talk with the patient, but then it's not easy to break bad news to a patient. It's not easy to tell a caregiver that to talk even about, palliative care, to talk about resuscitation, what are their views, how are they going to do. So it's not easy. So we need the healthcare workers to be really trained in breaking this bad news, to be empathetic, to listen to the people. However, coming to we are talking about the psychological safety within an organization. So I'm pretty sure those who have been reading, especially the Harvard Business Review, you would know that actually nowadays, not like before, 1 in 10 person who leaves a job is because of the culture of that organization. So when there is a bad culture within an organization, they don't stay put anymore. They just leave. And healthcare is, we talk about shortage, shortage, and shortage. It's an industry, it's a, institution where we need our staff to be retained. So my question here is that how safe are healthcare workers to talk, to raise their concerns without them being humiliated, without them being saying that, why are you talking about what, how much do you know about it? So they should actually be very, very safe in talking about what's happening, in raising their concerns, in telling the management what they see and what they want. So that psychological safety is giving them the space to Dr. Amani to be comfortable in expressing what she sees, what she wants in front of Dr. Yasir. For us to sit here and talk about our own issues in front of Madam. So that's what the psychological the space where we are not blamed, the fault finding culture is not there. So that's where we're talking about the psychological safety. And when something happens, we have been asking the question who, and even now I would say that a lot of institution is asking who did it, rather than how did it happen. But the main question now where patient safety is moving is not even how did it happen. The question now is, what did you learn out of it? So if we have to be a learning organization, we have to have that comfort zone to say that I am concerned, I am uncomfortable, and there is something that is not right here. So that particular culture needs to be inbuilt within us. I would also like to take an example from AEH itself. AEH is one hospital where I have seen actually supporting, celebrating your support workers. Every year you celebrate your support workers. Take few minutes to ask them what are their frustrations. So we celebrate them, but are they comfortable in telling us? These are people who are actually the backbone of an institution, of a healthcare institution where they do all those nitty-gritty things so that life is easy for rest of the people. So do we ask what their frustrations are? They will come up with innovative design thinking to tell us to make their life easy. But we have to have that particular environment within our organization. They should know that I would not be reprimanded for saying what I have to say. Then comes the patient safety incident reporting and learning system. Majority of the time, even in the Western countries, we see that when an incident happens, there are very few, as less as 15% actually come out and say that this has happened. Because the culture is not safe. They don't talk about it. We are so much into blaming the person. And when we talk about issues, the empathy towards the victim or the person who is harmed is huge. But do we sit and think about the person who is on the other side, the healthcare worker, the second victim? There's no intention to do harm. There's no intention. Unless and until when we talk about, just culture, we need to find accountability mechanisms, and we need to look that whether the action that was taken by the healthcare worker was, not within the boundaries, then definitely that accountability mechanism has to come, things has to be put in place. But when there's no intention to do harm, how many of us go home and cry because of what has happened? Although we have done, the maximum we have done, there may have not been any harm. When you see a young person dying, when you see a small child dying, it affects us as well. So please think about this second victim as well. The grievance mechanism had to be there. There has to be their psychological safety, an opportunity for them to talk. They have to have joy at work, doing the work that they are doing. So it's actually a two-way thing. We need to talk about the errors we make so that we give better patient safety. We need to talk about the errors we make because there is this person who needs to talk about it, who needs to come to terms with what more could I have done, what more could the system have done, what have I learned out of this so that this doesn't happen again. And when we talk about zero harm, remember that we are talking about zero avoidable harm. In healthcare, there may be instances and there will be instances where the harm is not because something went wrong, harm is because of the care that, that has happened. A complication with the Panadol is something that is out of our control. It happens. So my advice, because Dr. Yasir is here, because you are here, because Sophie is here, and also Shah and all those, the head of support workers, I think you need to create that environment within this organization. You have ample opportunities. I see them. That's why I talked about you celebrating your workers as well. So give that space, open that space, tell your staff that they can come and talk about whatever they feel talking about, and they can say whatever they wanted to say. It may be somebody doing something wrong which they feel is wrong at a higher level of hierarchy. We don't reprimand you saying that, see, you're not a specialist, you won't know. No, we don't say that. We listen to them, we explain to them if there's something else. So yeah, psychological safety is something that we need to talk about. We need to tell our staff that you talk about, I am concerned, I'm uncomfortable, there's something wrong happening. So this is something that has to be inbuilt.
Shtahe, that was very insightful. Finally, my last question is for Dr. Padma. Before I ask the question, I would like to help the audience grasp the gravity of the issue that we are going to talk about. You said the word avoidable. I'm also going to talk about preventable harm in healthcare. Preventable harm in healthcare industry is a global crisis, right? We can all agree on that. To put that into perspective, I would like all of our audience to imagine 2 A320 airplanes. If the same amount of preventable harm that happens in healthcare industry were to happen in the aviation industry, 2 fully loaded A320 airplanes will be crashing every single day. That is the equivalent of the amount of harm, preventable harm, that is happening in our industry daily. Hard to imagine, isn't it? Now, my question a difficult question, I'm sure, to Dr. Padmal is, how do we tackle this issue? And who holds the responsibility of addressing this major issue that we have? And how can we empower and engage patients to improve their own safety?
Oh, you have put me in a lot of trouble, but I'll try to give a reasonable answer. Your example. Before that, let me go back to your first sentence on diagnostic error. Okay, you spoke about 4 things: misdiagnosis, incorrect diagnosis, delayed diagnosis, and miscommunicated diagnosis. Good. And then I will take you to a country study. Okay? It's related to what your aviation example. In 2021-22, during the COVID pandemic, Maldives completed a study called the STEP survey. Okay? STEP survey is a NCD condition and risk factor survey. What it identified is that out of the hypertensives and diabetics, by the way, Maldives has a 84% burden of disease from NCDs. Okay, that's a fact. 84% of your disease burden is from NCDs. And it identified some 26% were hypertensives and some 13% were diabetics. But mind you, the bad thing about what we found out was that 1/3 of the entire people who had hypertension and diabetes were telling they had never been screened. They didn't know about their diagnosis, misdiagnosis at community level. I thought the health system, I am upping the ante for thought, okay? Now, she was referring to the healthcare system for patients, I think. Now, I am referring to the sick people in community included. If that were to be included, the planes number would be more. We are missing whole lot of diagnosis in terms of misdiagnosis, and at hospital there is again misdiagnosis, incorrect diagnosis, delayed diagnosis and overdiagnosis, and also miscommunicated diagnosis. So that's the ground reality. And in order to answer your question, the Thais have something called the 3 forces that move the mountain. Now, I understand there are 4 forces that can move this mountain for Maldives. Okay? You ask what can be done, no? So, I understand there are 4 groups that are responsible for moving this forward. Number 1 is government and policy. For example, if the government only considers sick people treatment and not consider the undiagnosed sick people, that's the issue. But luckily, the government and Her Excellency's husband has made it sure that everyone above 18 should be screened. All hats off for that, taking leadership in that. The other one is on policy, legislation, regulatory frameworks that has to be there in order for the health system to function. That is where the government and policy comes in. It dictates the finances that goes into health system. It dictates the policies and legislation and what to be screened, what not to be screened, and so on and so forth. So therefore, that is the first force that pushes this mountain. Number 2, it's the health system. Okay? You have a multi-layered healthcare system that also is having overseas treatment component here as well. And there are health system delivery modalities in the system. I'll give a small example of not Maldivian one. There was this person, and on his 28th birthday, he visited a blood donation center to donate blood. Okay, and on that day, they identified that this person is having hypertension. So they didn't take blood. They asked him to come 2 weeks later. Checked again it was hypertension. They referred to the nearest hospital. You go and get it checked. They did all sorts of investigations and identified that he didn't have underlying cause but essential hypertension, but had to be on controlled treatment and follow up. That is a success story, not a missed or diagnostic error, but a success story. I'm just highlighting because it is coming out of a functioning health system. So the health systems have to be geared in such a way that the frameworks for identifying or detecting diagnostic errors has to be there. The modality of diagnosis has to be there, and it has to be done in such a way that it is efficient, effective, sustainable, realistic, and evolving. We can have all sorts of wish listers, that we want for our country. But at the same time, you only have 20% of budget for health. So therefore, it has to be managed in such a way that you have an efficient health system, so that you identify where the funding, or I'll rather rephrase, investment should go into healthcare, so that there is money for advancements in healthcare like AI, then all the necessary digital technologies to be there at equitably accessible to the population, not at each and every small island center, but equitably made available to the population. That's the second one. Third huge component is the human resources for health. Okay? Each and every one of our teams, doctors, nurses, paramedics, laboratory technicians, even the janitorial staff, and all of us, the health system, has a responsibility to adhere to the quality standards, adhere to QC's Maldivian health quality standards, and even beyond. And the administration, like Dr. Yasir, has to make sure that the entire team is accountable for maintaining these standards. And each one of our healthcare teams has to have that mentality of continuous professional, lifelong continuous professional development. Otherwise, the global community will have AI. But if we don't know how to utilize that AI, you will have GIGO, garbage in, garbage out. If you don't give the proper commands, you will not get the necessary technology or necessary answers. As my colleague would agree, AI does hallucinate. So you need to identify how you prevent the AI not to give a hallucinated answer to your queries. It's just the beginning, but it will go on, and you need capacity development lifelong in terms to handle that, not only on AI, but the most simplest one. Because Maldives has a expat-driven health force. Your turnover is very high. So therefore, continuous capacity development, CME, CPD programs, in-service trainings, and also orientation programs, and conferences like this are of paramount importance. That's the third one. Fourth one, or the fourth force that pushes the mountain, are the people. We advocate for people-centered healthcare systems, people-focused healthcare systems. So the crux of people-focused healthcare systems is that we cater for people's needs. And if you don't have complaint mechanisms and grievance handling mechanisms like the Mahara platform, you don't have a people-centered healthcare system. That's the start. So I would really encourage you to do more and more on those aspects. So those are the four forces that pushes this mountain. And I think I plugged in the answers on how best to do it as well. So I think I have answered both your queries in one go. Thank you. And by the way, that person is me. I am living now thanks to good diagnostics, timely detected, timely communicated, and put on treatment. I have been on treatment for now more than 2 decades without complications. So I make myself the case for others to learn. Thank you.
Thank you, Dr. Padma. We have come to the end of our panel discussion. Thank you, Dr. Padma, Tahe, Dr. Yasir, for your valuable contribution today. It was my honor to moderate this panel discussion, and I hope our audience has had meaningful insights around diagnostic safety, overall patient safety, especially in the context of peripheral hospitals and overall Maldives and a bit globally as well. Thank you very much for listening intently, I hope. Thank you.
Thank you, distinguished panelists, for sharing your valuable expertise and perspectives with us today. We deeply appreciate the time and thought you have invested in being part of this event. As a token of your gratitude, we would now like to present certificates of appreciation to our panelists. May I kindly invite on stage Ms. Sophia Abdullah, the Nursing Director of AEH, to present the certificates to our panelists. Ustaza Taslima Usman. Dr. Padmal De Silva. Dr. Ibrahim Yasir Ahmad. Dr. Fatimat Amani Nasir. Thank you, Ms. Sophia. Thank you, Ms. Sophia. Thank you, panelists. Let us now take a moment to watch a video that places the patient experience at the core of our work, emphasizing why our efforts in patient safety are so crucial.
Mari addu Victoria Hospital Karvange Mavarangina Thachri Bath and Yapori NMS de Thachri Bai Kabule to Hamasako Lambe Furatama Thachri Bai Ki Aradamile Puri Thachri Bai around me Marabot Sehi come in Dima making Varagina for nothing around a doctor that can have a clinic that goes a doctor they could Gakanda around Handamadi Hamayakin Satar Faraburin Gina Fahara Hama continuous come Mahakin around a doctor they could enemy some come Faraka base doctor that money then around a buyer can episcala Hagi to the Dima making Murani cake come and when I don't give issue a cake back coming around the around Advocatorial Hospital, gynecologist doctor, Mideki, the Kafa, a doctor, Mideki were bad test to the car, then scan, and then around the Anguli, around the Polip, Muragan, and ask the Gator to the Marvikin Mura issue, the Marvikin. Then around Dr. Lafa, we Polip remove Kuran. Surgery minor surgery then Polip remove Kuram Hama Evrina procedure that for the those putting admit begging Arata Puramani me එමෙ ප්‍රථම එක්ස්පීරියන්ස් එක ගයිනකොලොජි ඩිපාර්ට්මන්ට් එක තිබිනාස් අර කෙයාරින් නර්සස් then bara bodan ekala vekin ule gota kuriyan ule procedure taka amadu purana gota ka uri anche bara rangala kiyade then ekam alonda mara bodan ekara always kannenge nihar ekani by faramule nuni ek bystander kan ek me faraten hunna iruga base tanganna anje iruga matiga ora fatiriyan annanje huma ekani onnanje huma misalaka let's say then alonge case kalonda ki tankole mi young meena kapima issue demand wedane kamako let's say above 65 years ke mi hakko ekala halat ekda ekani baba noni kodu kujja ekani baba kannanje halat uga mara bodan lagu ge nana kandige ei alonda aradeken benu adu hen Ikuta base nagan tiliyan nuni by far ane terega minna STO pharmacy nudi bijja kamuga wanina mami anna bijjani parat duran hinga far peran nanjeni ei asto handu hodam beno makam then alonda operation theater beddiruga ma doctor fennani salon henata injection ja hammis de kodo hedinde kameta tibinas it's like eka mamma amuga tega kametima memes benma mamma carry kamunna e malunda fenigende ekalaronge mamma kala nin kamagaga film apakiya deepo ke wani rangal wani ekhala paran oga teri narunta ke narunda me dimami ema ei alon waran ufavi kame then operation theater in kamani kavis ni gyne department hama dimami issue then irudeka me kaachi hodumga warboda dateli eka komme pahar misal kalanmenna ki maradu noni ekhala rarusungana farattaka bairuga komme pahar prashun kaachi genuma ki ha possible kama kannu then ekamako thanu carry noni order cooking e dibena possibility en niya moves ekala gegatuka wararangal wan kanne then ඒ අරුන්ගේ personal experience ka pahaga vikam then අරුන් මම එබ්බස්ති මාවිෂෝ මම වරගදේ හොඩු ලාන්තෂි හොඩු හොඩුලනි වරගදේ බී කමෙන් එක then අරුන් men BDI හම ක්ලිනික ක ડોක්ටර් දසෙන් බේනු කුරම දේවස් එපිසෝඩ් කන් හල්ලෙනු එම් මම then අරුන් men ගෙදේ මරදු health center in bala faitaino doctor suggest kori ඒ මම maru cousin AH phonogin mamma test tan hadda fa MRI episode mamma ge emergency kon hadda fa mamma ge ni gohoro bedi favorika mage me e test tan hadda first b going ni good ni thanum den engigen ane emergency ga mamma phonovi male de male me sekam mamma ge test taken hadda fa mamma phonovi me India alonde tangarani hagegatuga me vara bodu patient unabis eyelash nuni alon menna ki vara busy life gole wazifa gole me chutti naganda ayruga vara bodu taklif kan alon menna ge babe komme paharak male gussa emmenna ki fora by non detto he alon menna kan e me kulidak kagen me keunge harada me murika me vara bodu taklif kan me gendani ginafara nasandetru konge ni kuya mikanga cover enno kure mamille kurenche heruga miha bodu kamegga rajya mela danje heruga direct kon almenna flight sebove edetto lanka ni lanka flight ehma almenna direct ko addu victoria hospital ne dueri ko rajya mela danje halattu devene hada possibility e gamige diumaki almen marapodan ede kamege ehma kureng tanuga migutan hama mi mikam pahiko devuma alon warabbodan ede me adi hama mi alon mamma mi tanuga admit ko ge mi experience ga fa kurve ka mi komme paraka kalonda kandu en kurve den ehen mi mamma ge sister mi hakku onna eruga doctor anna gadi komme paraka salon office ga kurve fami annande doctor anna mi onna gadi nuni annane kama mi alon menna mawdu matlibe gadi then e gadi takuga eka doctor naade dicche kamga wani nama waragena time alon menge eba waste we office ga tibe fanner warabodu dachakabe egotan alon menna doctor sida anna gadi mi name doctor mi visitor da iruganu specialist doctor anna iruga patient side of this bystander kan mauduma tarangala ingena faratin gurumaki patient safety of this none arumenge me hospital of this adi family of this emma nagalu kanne e mara marabodan eden e commerce gotakan eka me nagalu gotaka manage kuragegen me daane gotakan arrange gung e marabodan edekam patient unge ಸೇಫ್ಟಿ ರೋಗ ವಾಹಕ ಮುಂದಾರ್ಗ ಪೇಷಂಟ್ ಗೆ ಸೇಫ್ಟಿ ಅವರ ಬಡ ರಿಲೇಟ್ ವಾಕ ಮಿದೆತೋ ಮಿ ಪೇಷಂಟ್ ವರ ಬಲಿಹಾದ ತಗೊಂಡು ಪೇಷಂಟ್ ಕು ಫ್ಲೈಟ್ ಅಂಗವ ಮಾದೆಗ ತಳುವ ಫಣಿಕ ಮಿ ಬೇಡದಿಲ್ಲ ಮಿಕ ಲಕಂಕಂ ತಣುಗ ಮಿ ಎ ನಿಜಾಮ್ ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಕಿ ವರ ಮುಹಮ ಕಮೆಕ್ಕಮ ಅಳವಣ දෙකෙන් එහෙම වීම අරන්නේ දෙනි මේ තනුන් කුරේ කංකම් ගාරන් මෙන්න මාලේ දාන්නු ජෙහි මේ තනුන් එ හිදම ලිබේන පද ගොතක පට්ටම් වෙගෙන් තියෝ thank you.
That patient testimony serves as a powerful reminder of why we do what we do. We're now approaching one of the most important highlights of this afternoon, the inauguration of Aduyku General Hospital's Patient Safety Committee. This committee will play a pivotal role in advancing our commitment to excellence in patient care.
It is my honor to invite First Lady Madam Sajida Muhammad to inaugurate the Patient Safety Committee and award pins to our committee members. First Lady Madam Sajida Muhammad.
Dr. Ibrahim Yasir. Ms. Sophia Abdullah. Dr. Fatmat Amani Nasir. Ms. Nizna Hussain. Shah Said. Ms. Azlifa Abdul Aziz.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وبعثه مقاما محمودا الذي وعدته وارزقنا شفاعته برحمتك يا أرحم الراحمين وصلى الله على محمد وآله وصحبه وسلم والحمد لله رب العالمين.
අලුන්මන්නකේ අලුන්මන්න නුවානකම වෙච්ච කමුග වඤ්ඤාම එම්මෙ ෆුර්තම එක නුවාන බුණාන මිහු
ඒකි රොඟුරොඟු අලුමෙන්ගේ ගවම හිදුමෙක්කො දෙබාෆවා අදි හිදුමතුග මිහාරොස් දෙමිතිබේ බේෆුණුන්ගේ අදදු වරගින
අසුග කමෙ කුරුමුගේ එම්මෙ මුහිම්ම කමකි ෂෝයින්නු යත
ಕ್ಲಬ್ತಕ ಆಮ್ದನಿಯಲ್ಲಿ ಲಿಬಿ ಕ್ಲಬ್ತ ಕೊಳ ಜಿಹುಣೀಮ ಅಸೋಸಿಯೇಷನ್ ವರ್ಗದ ವೆಗೆಂದಾಣೆ
ಎಬೇಫುಣ್ಗೆ ತಜುರುಬಾಯ ವಾಹಕ್ ಫುರುತ ತಿಬೇಫುಣ್ಣ ಬೆಗೆಂದಾಣಿ ವರ ಶೌಗುವರಿ ಮುಹಿಮು ವಾಹಕ್ ಫುರುತಾಕ
මිහාරු මසෙක්ක ගිනකමුග වියස්වෙස් ඒරුග උෆුදන්ජය තක්ලීෆ බොඩු
ඒරු දිව රාජ්‍යයේ ගෝරිහා රජතුන්න දීනීගතුන් කුරංජේ කන්තත්ත කොන් උළුමුගේ මාලුමාත් ඉල්ම එංගි ෆොහොඩ්
මේ හිදුමෙත්තෙන්ගේ වාහක් ෆුරුතක තජුරුබා තිබේෆුන්න වෙගෙන්දානි වරන් අගෝරි ෆිලාවුල්තාක
ಹಿದುಮೆತ್ತೆರಿ ಹುಕುರು ದುವಹು ಸಾದಗಡಿ ತಿರೀಹುಗ PSMNEWS
So since then, we have been celebrating World Patient Safety Day in taking over different themes. So what is the agenda behind that? The agenda behind having a particular World Patient Safety Day per se is to advocate. If we didn't have this venue, Dr. Yasir would not get the opportunity to invite First Lady to come for the World Patient Safety Day. Simple as that. And not only that, it creates an opportunity to respond and share the findings. You advocate, identify the priorities, respond, and share the findings. So therefore, that is the idea behind World Patient Safety Day, which falls on 17th of September of each year and celebrated lavishly and also very focusedly in Maldives. Okay, now I'll come to WHO journey in Maldives. We started our journey as early as 1951, 3 years after our inception. We first came here to support the country in a filaria mission. The partnership we built with the government of Maldives and Ministry of Health Maldives has grown from strength to strength, and we stand by as partners with Maldives Ministry of Health and other ministries related to health, and now with Addu Equatorial Hospital as well. This time I am really glad and I am happy that we were able to partner with Addu Equatorial Hospital in this wonderful patient safety conference. And I am also as glad to partner with Quality Commissioner in putting out the Mahara platform launched on the 17th of September. That is the pillar of people-centered healthcare. If you have a people-centered healthcare, you should give them the opportunity to give feedback and also have a grievance mechanism. So you have done that. All hats off to you and congratulations to you. And today I will now focus on a few things I have observed on the health symposium, patient safety symposium at Addu Equatorial Hospital. I have attended many a symposia, many countries, many forums, and this is second to none. So take it from someone who has a huge background in academia that this is second to none and it is of international level. So give yourselves a warm round of applause for that. What I observed here is that every minute detail had been thought of and accounted for in the planning. And in implementation, from keeping the time to taking part, it had been thoroughly planned and well executed by a professional team, not only of doctors. That is the nicety of that. It was a joint effort. Doctors took part, nurses took part, physiotherapists took part, and other stakeholders took part. While I was seated there and listening to you, that's what I had observed in highest professional caliber. So all hats off to you again, and please give a round of applause for that component as well. And I'm really happy to observe the culture of symposia, sharing of knowledge from the lowest or southernmost atoll that I have not seen in Mali this often. So it's something that we want to inculcate in the medical fraternity, so that innovations like this or innovatory practices are there, compiled, discussed and disseminated. That's the main idea behind symposia like this. And it's the main idea behind having a World Patient Safety Day as well. So I would, as my last comment, I would want to congratulate each and every one of you who took part in the sessions, organizing it and taking part. And I want to wish all the very best to Addu Equatorial Hospital, and I would expect lot of innovative, good things to come out of Maldives as Maldives with WHO's partnership has been a front runner in the health mandate or health field in the region. We have had an achievement and a medal since 2015, every RC. We continue to do so. And I'm happy that we are expanding to the sub-levels, and Addu Equatorial Hospital and other atolls, I would expect the same from the country. Thank you and all the best.
Thank you, Dr. Padmal. Your expertise is vital as we strive to enhance our patient safety in our hospital. Following that insightful address is another significant moment in today's event, the inauguration of the Patient Safety Strategic Plan.
This initiative is crucial as it sets a clear path to enhance the safety and care we provide. By focusing on proactive measures and continuous improvement, we aim to ensure that every patient receives the highest standard of care from our hospital.
I would like to kindly invite the First Lady of Maldives, Madam Sajida Muhammad, to inaugurate the Patient Safety Strategic Plan. Madam Sajida.
Thank you, Madam. This inauguration not only marks the start of a vital collaborative effort, but it is also a call for all of us, administrators, clinicians, and support staff, to unite with a shared vision for patient safety. Our success depends on the collective engagement and effective implementation of these strategies. As we move forward, let us remember that these are not just a set of protocols, but core values that should guide every aspect of our work.
The next item on our agenda is an address by Ms. Sophia Abdullah, the Nursing Director of AEH. Please join me in welcoming to the stage Nursing Director, Ms. Sophia.
Bismillahirrahmanirrahim. Distinguished Chief Guest, Madam Sajida Muhammad, CEO of Addu Equatorial Hospital, Dr. Ibrahim Yasir, Quality Commissioner of Maldives, Ustaza Taslima Usman, WHO Medical Officer Public Health, Dr. Padmal De Silva, our Medical Director, Dr. Fatmat Amani. Esteemed delegates and my dear colleagues, Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good afternoon to you all. It is an honor to address you all today at this important patient safety conference. Today marks a pivotal moment in our journey towards safer healthcare. The essence of our work, healthcare professionals, revolves around one fundamental responsibility of protect lives entrusted to our care. Patient safety is not just a goal, it is a foundation upon which quality healthcare is built. As we gather to celebrate Patient Safety Conference, let us remember that every action, every decision, every process in healthcare must be centered to one principle, that is, do no harm. While the global statistics on patient safety may be sobering, today is about solutions, about collaboration, about collective commitment to change. The World Health Organization reports that 134 million adverse events occur annually in healthcare, resulting in 2.6 million deaths in low and middle income countries. In high income countries, 1 in 10 patients is harmed during their care. Medication errors alone costs over $42 billion annually. And diagnostic errors occur for 10% of patients' deaths. These figures highlight the urgent need for action at both global and national level. At AEH, we are acutely aware of these challenges and have identified medication administration errors and patient falls as two critical areas where improvements are needed. To date, collecting complete data on patient safety incidents has been challenging due to auditing limitation, but we are committed to addressing these shortcomings. These issues are not unique to our institution. They are global in scope, emphasizing the need for comprehensive strategy. Though preventable, these incidents remain persistent challenges in providing safer care. Addressing these issues require a systematic institution-wide approach. Our strategies to enhance patient safety at AEH focuses on several critical areas to enhance patient safety at AEH. We are committed to providing comprehensive education and ongoing training for our healthcare teams, ensuring they are well equipped, identifying risks, prevent harm, and manage common errors such as medication mismanagement and patient falls. Furthermore, enhancing our monitoring and reporting mechanism is essential for reducing adverse events through analysis and implement evidence-based interventions. Finally, fostering a culture of safety is paramount. We will encourage every staff member, regardless of their role, to actively engage in safeguarding our patients' well-being, creating an environment rooted in open communication, accountability, and continuous learning from incidents and near misses. This conference symbolizes our renewed commitment to creating a safer healthcare environment. It is thought the combined efforts of every individual in this room that we will build a future where patient safety is embedded in every aspect of our healthcare system. Let us commit ourselves to this vital mission, ensuring that we adopt comprehensive strategies, foster a culture of safety within our healthcare system. Together, we can make a meaningful impact and create an environment where every patient receives the safe, high-quality care they deserve. Together, we can transform this vision into reality, and also together we can get it right and make it safe. Thank you for your dedication and partnership as we embark on this vital mission. Thank you.
Thank you, Ms. Sophia, for your compelling speech. We deeply appreciate your ongoing commitment to this vital aspect of our mission.
Next on the agenda is a speech by our keynote speaker, Dr. Muhammad Wahid, on the topic of preventing surgical site infections. Dr. Wahid is a plastic and reconstructive surgeon and head of surgery at IGMH. He holds an MD from Santa Clara Medical School and specializes in plastic surgery at Sri Raj Hospital, Bangkok. Please join me in giving a warm welcome to Dr. Muhammad Wahid.
Bismillah ar-Rahman ar-Rahim. The First Lady, Madam Sajida Muhammad, CEO of AEH, Dr. Ibrahim Yasir, distinguished guests and participants, Assalamu alaikum and very good afternoon. First of all, I would like to thank AEH for inviting me for this successful conference. I would like to congratulate all team members of AEH for having this very important and very successful conference. Thank you very much. It is an honor for me to be here to speak on a topic of utmost importance in surgical department, which is not only for surgical department, but for whole health sector. It is to prevent surgical site infection and how it directly impacts on patient safety. As we know that surgical procedures, whether elective or whether emergency, that is always associated with certain risks. Among these risks, most preventable risk is surgical site infection. Surgical site infections are infections that occur at or near the surgical incision within 30 days, or if there is an implant, it may go beyond that. So these infections can cause significant threat to patients' recovery and safety. It can prolong hospital stay, increase medical costs, and in some severe cases can lead to life-threatening complications. However, the good news is that surgical site infections are largely preventable. Implementing rigorous infection prevention measures can significantly reduce incidence of surgical site infections. I would like to highlight three main areas that we can do enormous work in reducing surgical site infection. First of all, the proper preoperative care, which can include screening of the patients, educating the patient for surgery, and also hospital must ensure that operation rooms are thoroughly disinfected, sterilized to create sterile environment for the procedure. Secondly, intraoperative protocols, such as once the patient is in the operating room, a sterile field must be meticulously maintained. And surgeons and entire team should adhere to the best practice in surgical technique to minimize the tissue trauma and prevent contamination during the procedure. Thirdly, postoperative care. Infection prevention does not end once surgery is over. Postoperative care plays a critical role in ensuring successful recovery, monitoring the surgical site for early signs of infection, education of the patients, and follow-up appointments are essential. At the core of effective infection control is commitment of healthcare professionals, doctors, nurses, and all staff involved in patient care must be vigilant, adhering to evidence-based practice and infection prevention guidelines. Equally, it is important the role of leadership in fostering a culture of safety in healthcare settings. Hospital administrators and policymakers must ensure that resources are available for staff training, up-to-date equipment, and robust infection control system. So to conclude this, preventing surgical site, it's about saving lives. Preventing surgical site infection is about saving lives, reducing suffering, and ensuring that every patient receives safest possible care. By focusing preoperative, intraoperative, and postoperative measures, we can drastically reduce surgical site infection. So let's work together to ensure that every surgery we deliver have the safest and healthiest outcome for our patients. Thank you.
Thank you, Dr. Wahid. Your expertise is greatly appreciated.
Up next is the official inauguration of the Advanced Wound Care Management Service, a momentous occasion for our hospital and our patients. This service represents a transformative advancement in patient care, offering innovative solutions that will redefine wound management and significantly improve lives. It is my great honor to invite the CEO of AEH, Dr. Ibrahim Yasser, on stage to officially launch this service. Dr. Ibrahim Yasser.
Thank you, Dr. Yasser. May I now kindly request you to address the gathering.
Bismillahirrahmanirrahim. Respected Chief Guest, First Lady Madam Sajida, Deputy Mayor of Ado City, WHO Medical Officer Dr. Padmal, Commissioner of Quality Assurance, Ustad Taslima, our guest speaker, Dr. Wahid, my dear colleagues, invited guests, and ladies and gentlemen. Good afternoon and Assalamu alaikum. Today, before I start my speech, I just want to tell you a story. This is a real story. A patient who is a regular hospital visitor, he comes for routine dressings, comes in one morning only to face a tragic accident. A simple slip on the ramp on the OPD ends up shattering his hip. It's a heartbreaking story and one could that have been avoided. This incident was the catalyst for the significant change in Ado Ikitro Hospital. That is the reason the Patient Safety Committee was formed. When I received the patient complaint that morning, I immediately sought to address the issue. I directed my PA to forward it to the Patient Safety Committee for investigation. However, to my surprise, we did not have a formal committee in place. Fortunately, I have to say that our hospital has a very good quality improvement and patient safety unit, which was established in the nursing department. They were diligently investigating incidents and providing recommendations. Recognizing the need for a more comprehensive approach, I decided to establish a dedicated including administrative heads, to discuss these incidents and identify root causes and implement necessary changes. That is the reason the Patient Safety Committee was formed and which was inaugurated today early in this session. And yes, Taslima was asking me, we are going to include a patient representative in the committee as well. Since its inception, our committee has met monthly to review cases and develop strategies to improvement. One of the most significant outcomes has been the implementation of measures to prevent similar accidents from happening in the future. Remember the patient who fell. He required hip replacement surgery. A simple visit to the hospital for a wound care landed up with a major operation. And do you want to know what the Patient Safety Committee has done? The ramp now has a hand railing. The ramp now has a anti-slippery stickers on it. So it's an important step that has been taken. Thanks to the changes implemented by our committee, we have been able to reduce the risk of such incidents in the future. A simple change in the system can prevent a lot of pain and suffering to our patients. Our story is not unique. The patient safety movement, which started way back in 1999 by the Institute of Medicine report, To Err is Human, highlighted the alarming number of preventable medical errors that happens all over the healthcare institutions. This has spurred healthcare organizations around the globe to prioritize patient safety. The key factors that have contributed to the progress in patient safety include creating an environment. Today, in the morning also, we are talking about it, creating an environment where health professionals feel comfortable reporting errors without fear of punishment. Also, we have discussed the advance in technology has created an environment where electronic health records have helped to reduce the risk of errors. You will understand the way in which we used to write prescriptions before. There are so many errors that happens when we have eligible prescriptions. So electronic medical records has been wonders to reducing the risk in healthcare settings. And in the future, as we have discussed, using more of artificial intelligence to reduce the risk of errors can improve the patient outcomes. And also, again, we have discussed about the communication gap, working together as teams to address the issue of patient safety. While we have made significant strides, patient safety still remains a complex challenge. Stories of medication errors, stories of hospital or healthcare acquired infections, and stories of patients falling from bed are stories that we hear daily in a hospital setting. I'm sure someone from the audience will remember a patient who received a wrong medication, or a patient who has undergone surgery and later had some infection, or a patient who has fallen from a bed. These are real-life examples of the risk that patients face inside our healthcare institutions. But there is hope. By focusing on key areas, as Dr. Padmal has indicated, we can make a real difference. Preventing medical errors, implementing measures like barcoding, e-prescribing can help ensure that right medication gets to the right patient at the right time in the right dose. Combating surgical infection, Dr. Wahid has already told about it. I don't have to tell anything more about it. Improving communication is very important. Enhancing communication and teamwork among healthcare workers can prevent misunderstanding and errors. And about the patient empowerment, encouraging patients and their families to be active participants in their care, especially in the early diagnosis part. If they give correct information, if we are able to talk to them, get the information from them, we'll be able to arrive at a diagnosis, at a correct diagnosis at an early stage. For all those here who work in the hospital care setting, I just want to urge you to take patient safety one of your priorities. Before concluding, I just want to express my sincere gratitude to the First Lady for honoring us with this occasion in Ado City. And her commitment to patient safety is truly inspiring. Thank you, Madam Sajida. I'm also related you, Dr. Padmal, to Ado City. It's the first time he has come to this area. And his expertise in the panel discussion was a valuable asset to this patient safety event. And I'm honored that he accepted my invitation and contributed. Thank you very much. And our Quality Assurance Commissioner of Quality Assurance, Taslima, I would like to express my gratitude to Taslima for her excellent participation and for accepting our invitation. Thank you. And to you, Dr. Wahid, you came here not only as a guest speaker to this conference, he has already finished a 2-day pre-conference workshop. So thank you. I just want to tell that I personally would like to thank you for your contribution. I also extend my heartfelt thanks to the dedicated team behind this event, especially the Director of Nursing, Sophia, and his patient safety team, led by Nizna. Their hard work and dedication were instrumental in making this event a success. Finally, I would like to acknowledge the contributions of all the heads and their department staff who got involved in this, all the preparations that were gone behind the scene. Your support and participation have been invaluable. Thank you all. To all our participants who came from different regions of the country, thank you for traveling to the Southern Hemisphere for this important event. I hope you will benefit from the sessions you had in the morning. Please enjoy the warm hospitality of Addo City, and as I have already invited you, you are welcome to Addo Equatorial Hospital. Thank you, and wassalamu alaikum.
Thank you, Dr. Yasir. Now I would like to request you to present a token of appreciation to a truly distinguished guest.
As we all know, our First Lady has been a steadfast advocate for safety in healthcare, demonstrating unwavering dedication and patience. We are incredibly grateful for her tireless efforts to uplift our community and to serve as a beacon of hope and inspiration. It is my honor to invite the First Lady, Madam Sajda, to the stage to accept this token of appreciation and address all in attendance. Please join me in extending a warm welcome to the First Lady.
Thank you. Thank you for the token of appreciation. That was quite overwhelming. First of all, I would like to, the whole conference has been arranged in English, but then since I'm going to take the advice from our Quality Commissioner about effective communication, I'm going to deliver my speech in Divehi language in the interest of our public. Bismillahirrahmanirrahim. Dulahiyo kamaki insana mativeri niyomate kamgallevi ogavanta mang Allah hamdu kuran hayatuge komme kamige emme rakkateri magu dekkevi lobveti nabiyya yashai emen nabiyage ashabun salawata salam lavash Addo Equatorial Hospital ge Chief Executive Officer Dr. Ibrahim Yasir wadagen tibbe izzetterin emme ha hazirin assalamu alaikum wa rahmatullahi wa barakatuh Ade. Miyadu, algon men faha kuram midani duniyage balimihunge rakkatirikamuge duwas. Mi balimihunge salamata rakkatirikamuge muhimmukan emmenan angadini masha mikamang helun terikuruma faha kureve duwahe. Mikan algon menge miyadu mihingadia symposium adi miyadu mitanuga mi dekevunu huriha wahakatakum wes warabodang almennan aduivige hingatte. Me rajyage mifenwaruga duniyage balimihunge rakkaterikamuge duwas malen beruga faha kureve furatama fahar balimihage rakkaterikama masekke kurumaki muli sihi nizam ga himene emmenge shamilum beenum wakame migotun mi hospitalun isnenge wifada rajyage eki kankoluta hoga kulagaduko miduwas fahaga kurumuge iturun aharuge komme duweheggaves adi komme waguteggaves masikke kuramwani balimihage rakkaterikama iskandige balimihage rakkaterikamaki waki kamege gotuge anubala ei kura masakkataka lamehi fawa kamege gotuge dekige sihi khidmatige rakkaterikamaki divehinge iturun rajya gawle bidesi na rajya ziyare kura fatruweri na wes libidenche haggekam fahag kura midohoge tahuniya sihi khidumeteri nasha sihi nizam hingumuge masike kura faretekasha emmeha divehi rayetunna dannawa adi sihi nizamaki rayitunna rakkateri khidmatekkan kashwar kurma sarkarun kurawwa masakkattattaka rajyege izzette raisul jumhuriya asha sihata behe wazira midohoge tahuniya ariskura adi duniyaga balimihunga salamata rakkaterikama khasa duhe faha kuren feshoni dehas nawarwana har miwahaka almenna WHO ge Dr. Padmal ge faratum wes aduyuge hingajje ehe names alwada hama divehi bahun anekkais takurar kollani miwahakata eduwaki komme ahare ge September 17 wana duwas rajyaka midwas miyahar mifaha kureni miyaharuge shiara adi maqsadta hasil kurumuge ummeeduge miyaharuge shiar almenna wara ginafaharu ivige hingajje mitanuge improving diagnosis for patient safety ade bali mihage rakkaterika mattaka bali denegатumuge ಗೊತ್ತಂ ಹರುದನಾಕು ಫೆಂವರ್ ಮತಿಕೊರು ಮಿಗೊತು ಕಮಾ ಬೆಹೆ ಮಶ್ವರಾತಕ ಬಹುಸ್ತ ಕಟ್ಟಕ ಖಾಸ ಕಮಿಟಿಯ ಮಿಯದು ಮಿತನುಗ ಉಫೆದಿಗೆ ಹಿಂಗಜ್ ಅದಿಮಿ ಅಡ್ಡು ಇಕ್ಯುಟೋರಿಯಲ್ ಹಾಸ್ಪಿಟಲ್ ಗೆ ಫರಾತು ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಸೇಫ್ಟಿ ಯಾಗುಡೆ ವರ ಫುರಿಯ ಮಾದಿ ಎಹಾಮೆ ಮುಹಿಮು ಫಣ್ಣಿ ಕಾನ್ಫರೆನ್ಸ್ ಮಿಯದು ವಣಿ ಕೂರಿಯ ಗೆಂದವಾಫ algonda hama adives effaharu mitanuga hama ehem befulum ves faha kurevi miyadu mi gendia conference algonda miyadu mitanan aske mi fenunu manzara bala hama tiya befuluna hagigatu ke shukuru haggove em algonda ge namuga hama tiya huriha befuna wakin hasako Dr. Yasir ge malimi kamuge dashuga tiya team miyatti kurevamu genda amasekata asari bahai sabas tannawa mige ituru sihi khidmat for ko dinumuga balimihage rakkaterikama khas samalkame dinuma beenumwa usul takai procedure ta adi muli sihi nizam hardana kurumai muwazzafun tamrin kuruma ahulweri kurumuge masekke kuriya gendimaki aluganduge edume mi masekke kuriya gendiyuma wasiletta tanavas kurewumaki balimihuna libena wara bodu hinhama chehume dulahe komattaka huluwena waran itubaru huri mage hame hemme mikamuga addu equatorial hospital isve mifada badaltake kennam feshumaki ves mi fursatuga algandu wara faha kolla kame mikamuga sabum muli mi sarhadduge rattahoga diriule rayitunna a ummid taka itubar ade khidmat takai rakkaterikan libigen danikan yagin kura bali mihunge rakkaterika mattaka ala taaraf kurawunu strategic plan tamfiz kuruma bali mihage bali avaha denegatuma beenuwa intizam tarrevuma beenuwa besfarwage kankan avaskuruma dairage mozzfunge maglumat fumwe hunaru mativegen diumaki hagigat gas bali mihage rakkaterika ituruwegen daane kame adi strategic plan tamfiz kuramun diumaki libe warabbodu kuriyerume heyo badale bali mihunge rakkaterika mattaka bainal aqwami femwaruga duwahe faha kuren feshi ekamge waran hitama veri hagigeteke ekulewegen wati miyad algon menna mitanu efada etta hagigaten adu ivige hingacce samalkan devijjanama farwateri vevijjanama rangal kurevene etakkamen huriti ekan duniyage sihhat jamiyage dirasa takun enge duniyage sihhat jamiyan ham kuragotuga balimiyunga gotuga farwa deve komme dihamege hege teren ekaki farwa dinumge terega hede gohu gellundi be mihe migotun deve farwag sababu nuwat farwa deve gotuge sababu libe gellumuge terega aharaku duniyen 3 million mihun duniya du kure algon men kahala targi wamun anna gaum taka dan adi medfantige gaum tahoga mifala masalata ma bodu kama ve ama ehemme algon men na miyadu mitanun adu evigen dia algon men na diagnose nukure vitibi mita fasi sabge terega nuhimeneka ehem vumu mihar algon men na mi fenna waravuren ves itura mi number macca danekan hamayagi egotun dirasa indakka gotuga fagiru gaum taka medufantige gaum tahuga komme sateka mihakun hatara mihun faruha dinumuge terega hede gohuge sababu maruwe hama hemme nurangal ko deve farwag sabun gellumwa mihunge terega farwa dinumuge marhalage terega rakkaterikan kashavaru kurumun farwag sabun libe gellun kuda kureve nuwata avoidable harm in salame kurevigende balimiha deve behuge sababu nuwata bes deve gotun sihi gellun talibe munde farwa deve gotte midennevi tafat etan halati ves himene gotu doctor nudeki hedawa muddatu doctor dakkan hospital la gendiu mangadi hospital la gendiu mafahu laswa laswu dur tantanu farwa ya hameya awmuga ituralibe gellun hama ehemme bay fahara operation ta kurumuga ekashene samal kanu devun saftahir kama rakkateri nuevun ege sabun infect vun mige itura balli denegatumga ara olunta adi bali miha medu wes bay faharu olun ara munde ekaka denje he bes anikaka deve halat wes duniyage bayin hospital tahuga tajriba kure fa bahuri hama ehemme le olumuga di mawa kankan rakkateri lekan kashawaru kurun mifada etak kame mi huriya kamaka balairo min komme kamari kiye komme ves gotega divehinge tajribaavas gulifava kankam ei rajyege zamani sihi farwa fishumuga kurim ves adi ege fahum ves bayin halittahuga miharis mifada etak kame kurimative misalaka rajyaki kanduveri gaume divehin diruleni maakandikka durduruga atirifava waki waki rashuga ehem vima kulliyaka dimawa sihi halatiga vagi magum vies adi kanduge magum vies miharu bali miha eba ufule geneve namavis ekaman hedawa wagutu visnala mato adi bayen halatuga ekan kuram majburu wa gotamedu visnala mato rajyege kuda kuda rashiga hunna mihaka misalaka stroke jehum fada kame medurwa halatuga jehigen oy rashge hospital agendan jeheni kandu magu gada duwasware nama bodu tiralta hoge matiga e halatuga ituru gellunta medirum ki vedane kame rajyege tarikha belimas mikanka marafahaga kureve mege salihakkan ahar kuri vihomge terega niyavi etan anhenune duniya dukuri eta kudeku dinne algon menna wakive diei farwag marhalaga ekashene gotuga kankan kurefawa netumuge sabun kama eduas versi hidairaga masekke kuri eki befulum vidalwe ehem vima dive komme rayetege salamat sihat kashwar kurumattaka duniyage balmiyunge rakkaterikamge duas fahaga ko mikankam mihunge samalkam genas sihi kankan itura hardana kuram mase kurmaki komme hem ves kuram vecche kamekama algonde dekke algonge wahakama dev kuraka gastenno kuram ehennama ves adi detin etche dannawalana duniyage sihat jamiyage miduas faha kurmakama be hodun tawge matcha plane ta ekulawa labba fave eya eku masalta hallu kuran amal kuram vi goittake hasil kuram vi landu danditake faha kurawwa fave adi ekankan hasil kureveni kihine konkahala masakkate kon gotakak koggen kam ves faha kurawwa natija hasil kurevene gotam masikket battan kurawwa fave ehem vima duniyage sihat jamiyage strategic action plan ai egota adi algon menge rajyege vetta halata fete gota algon men ves masakketake kuranje hekama algonda fene emme furtakama rajyege halat denegatu divehinge kurimati huri masalta divehin tajribataka ege sababutan hodu divehinna datiwa masalta denegatu efahu ekankan hallu kurumattaka divehinna divehi rajya gule gota usul taken ekashayelu vihavis kina bege mashwaraya lafa hodu farwa libiganna faratakun hode maulumatai farwa de faratakun hode maulumata vis iskandevvu mi muassasataka siyasat kandaluwa farataka adi enum ves dairata himine shamil masikkatekam ga heddevu erum waran edeve natijatake hodi danekama algonda lafa kureve ade nimmalamu algon muhimmu detinkame faha kollana furtamakamaka balimiha farwa deve gotunna deve farwage bavatun furanayashai hashiganda bodeti gellunta vefavumaki rajyege tarihu gas adi mihares bay fahara tajriba kureve kame ehenkamu khidmatinumga farwa terive mikanka madukuruma nuwata nattaluma masikke kuru devana kamege gotuga faha kollam beenum wani mi hagiga gabulko algon men gaumi huriha levelligga mikamga mashwara ko arula nimmuntaka nimme tanfiz ko sihi dairaya ingilabi badalegge nawma masikke kuru adi fahukamege gotuga balimi hunga salamatattaka a usul takai a wasiletta taaraf kurevi furihamen ekankan tanfiz kureven fashadu haki divehi sihi daira usmintaka daturu kuru ehenkamu khidmatuge femwar rangal kurmuga balimihage rakkaterika nuwata farwage sabbum gellume vianu dinumuge mativeri maksad අබදුමෙ ඉස්කුරුමා අලුගොඬු තිය එම්මෙහා සිහි ඛිදමතරින්න ඉල්තිමාස් කුරා අලුගොඬගේ දුආයකි දිවෙහි රාජ්‍යයකි සිහි ගොතුන් ඉතුබාරු හුරි ರಂಗಳು ಫರುವಾ ದೇವೆ ಮುಂದ ರಾಜ್ಯಕ್ಕಂಗ ತರಗೀವೆಗೆಂ ಅವು ದಿವೆಹಿನ್ನಕಿ ದುಳಹೆಯೊಕಮಾಯಿ ಹಶೆಯೊಕಂದಿಬಿಗೆಂವ ಗೌಮೆಕ್ಕಂಗ ಲೆವ್ವು ಅಬದುವೆಸ್ ಕುರಿಯರುಮಾಯಿ ಉಫಾವಿರಿಕ ಮಿಂವರ್ ಕುರೆವ್ವು ಮೈ ಅಲ್ಲಾಹ್ ಅಲ್ಗೊಮ್ಮೆ ಮಿಕ್ಕಂಕಂಗೆ ಹೇಳ ತೌಫೀಕ್ ದೆವ್ವಾಶ್ ಅಸ್ಸಲಾಮು ಅಲೈಕುಂ ವರಹಮತುಲ್ಲಾಹಿ ವಬರಕಾತು.
We extend our deepest gratitude to Madam Sajida for your inspiring address. We are truly grateful for your support and the impacts your word have on our mission.
We have finally reached the end of our ceremony. To present the closing remarks, I would like to invite Ms. Nizna Hussain, Chief of Patient Safety of QID at AAH. Ms. Nizna.
Distinguished Chief Guest, First Lady of the Maldives, Madam Sajida, CEO of AIH, Dr. Ibrahim Yasir, Quality Commissioner of Maldives, Ustaza Taslim Osman,